Thank you so much. That was a truly inspiring story. And I hope that we continue embracing financial health globally and continue working towards measuring financial health, taking action, and tracking those efforts. Before closing our day 2 for Emerge Financial Health, and I hope that you're joining us tomorrow, I'd like to reflect about today's sessions along with my colleague, Tia Guerin, who leads our financial health polls at the Financial Health Network. Tia, thank you so much for joining me. Just to get us started, I guess we covered a lot of ground today. Why don't you tell me what resonated with you?
Absolutely, would be glad to. Before I jump into my reflections, first I just want to say what a fantastic first 2 days of sessions. I know that sometimes engaging in a virtual format can be challenging, but I personally haven't been able to look away. We've just really had some great content, great panelists. So reflecting on today's group of sessions, I want to start with what is perhaps not a very happy takeaway, but I heard a number of our panelists sound what I would call an alarm about various crises, multiple interrelated but distinct crises that are unfolding as we speak, that have been unfolding for years in some cases, that affect not just individual populations, but society as a whole. So we heard Scott Sanborn from Lending Club speak of a financial health crisis. He cited our pulse data showing that 2/3 of people in the United States are not financially healthy. We heard Elaine Bigelow from the National Partnership for Women and Families speak of a caregiving crisis. She shared what I would call some very staggering statistics. 10 million people cite caregiving as a reason that they stopped working. She also cited the statistic that $500 billion have been lost in economic opportunity simply because of lack of access to paid leave. We heard Jasmine Thomas at Citi talk about the racial wealth gap, which has remained largely unchanged over the past few decades, also correlates with high amounts of lost economic opportunity over the past few decades. And finally, we heard Rob Curtis from Daylight talk about challenges amongst members of the LGBT community. He began speaking about a total lack of data about this important community at the national level, but the data that he did cite was pretty alarming. He spoke of higher rates of mental health challenges amongst this diverse group, safety challenges that many in this community face, as well as a life expectancy, that was closer to 35 years for queer people of color. So really some alarming, some staggering statistics. But on a more positive note, I also heard a lot of optimism from our speakers today. Many of them pointed to solutions that are in reach and spoke about progress that has been happening in recent years. And I think that perhaps one of the most unanticipated outcomes of the past year was this enhanced popular awareness, enhanced common understanding of racial inequities and structural barriers, particularly for communities of color. Drawing upon our panelists' remarks and reflecting on those, we again heard Elaine speak of this care infrastructure. She spoke about how this holistic package of services was actually quite politically popular across the aisle, and she's optimistic that progress on that front for a holistic care infrastructure package may actually happen in the next few years. On that same panel, we heard Kavya speak about how employers are beginning to understand the need to invest in solutions. She also mentioned optimism, that she's really starting to see change on that front. Jasmine, I thought, provided a great example of financial service providers, groups like Citi explicitly adopting anti-racist policies, as well as other policies with an eye to inclusion, such as avoiding dead naming. She and Rob discussed that. And then Rob, I thought, so nicely represented this new cohort of fintech providers, new innovators who are tackling issues, in his case, particularly relevant to the LGBT community, but also many other fintechs going deep on understanding various communities of interest. So, the challenges before us are great, but I personally was heartened to hear such optimism, and such a focus on realistic, tangible, achievable solutions from the group.
Yeah. Well said, Thea. I mean, you just gave us a really great summary of today, and I fully agree. These conversations are truly powerful, and if anything, as you said, the pandemic really got people talking and what's going on and what have been the structural barriers that have that were not a consequence of the pandemic, but we've had for such a long time. And now it's time to think about solutions that are really long-term. It's not just solutions for the pandemic, but solutions that are real to solve some of those, or start thinking about how they solve some of those structural barriers. I have one last question for you. If you can quickly tell us, we talk a lot about the inequities deeply ingrained in systems across gender, race, ethnicity, sexual orientation. And we knew that those existed before, right? We talked about that. And, by now we know who has been affected the most. We know what the numbers look like. What is the point of continuing measuring financial health? You and I talk about this a lot, but why should organizations, governments care about continuing measuring when we know what the problems are?
Yeah, it's a great question. And I think it's frankly a question that I would answer by saying that measurement is now more important than ever, right? We need to continue measuring because we simply cannot accept the status quo. We now know that there are these massive financial health disparities exist between populations, between women and men, amongst populations of color, but that does not mean that they will always exist. So we can't just say we understand the issues. We cannot become complacent. We need to continue diving deeper, continuing to track to better understand financial health trends amongst these populations. Because again, if the last year has taught us anything, it's that millions of people, particularly low-income communities, particularly communities of color, are living on the edge with unacceptably high degrees of financial fragility. And again, I'll stress, it does not have to be that way. So only by continuing to collect data about financial health, about people's well-being, can we truly understand how people in the United States are faring financially. And we can't stop there. We need to disaggregate that data. So we come back to this theme again and again, but I don't think it can be said enough. We cannot assume that averages or national statistics tell the full story. They simply do not. And, the K-shaped recovery of the last year has taught us that. We need to dig deeper. We need to disaggregate. We need to look between populations and within populations as much as possible. And Rob from Daylight, I think, really made this point well. We can't assume we know everything about one community just from those top line or those aggregate statistics. And finally, we need to use data to inform our decision making. So each and every one of our speakers this afternoon, I thought, provided great examples of how they're doing this in their own ways. But whether you are a financial service provider, whether you're an employer or government entity, we need to all be using data to determine whether the solutions we're developing are making an actual difference in people's financial lives. Without collecting that ongoing sort of data, we simply don't know if these policies and solutions are making a difference.
Yeah, that was a wonderful way to end today. So thank you so much for those remarks. And as we close out our second day of this event, we'd love to know what conversations and topics struck a chord with you. So please answer. We're going to be sending a question shortly here so you can tell us what resonated with you. And that brings us to the conclusion of today's sessions on zooming in people and leaders. Before we wrap, I encourage you to join us tomorrow from 1 p.m. to 3 p.m. Central Time, where we will be spotlighting a few of the most promising and successful financial health partnerships, commitments, and solutions of the year. I'm sure you won't want to miss it. So we hope to see you then. Thank you for joining us.